Good evening, Renata. I am here at Cayuga Health in Ithaca, and I'm here with Dr. MacQueen, and he is a doctorate in infectious diseases. And if you joined us in the 5:30, we talked on to how Tompkins County now has 6 confirmed cases of COVID-19, and we'd like to talk a little bit more onto that and how Cayuga Health is handling this.
Well, we're doing a few things, starting with our preparation that we've been using for the last few weeks. We anticipated this, we're getting ready for it. Some of the things include expanding our testing to the community. We're putting a site together that's been up and running for a couple of days to make sure we have the ability to test and detect cases. We're doing things to make sure we keep our employees safe and have started restricting some of the access to the hospital.
Now, actually, that is one thing that we did recently find out is that Cayuga Health is going to be restricting certain visitors now. If we could talk on to that a little bit about what the visitation limitations are.
Sure. So for a few days, we have limited people based on their symptoms and excluded people if they had any symptoms. However, today the governor issued a guidance that we would need to limit all visitors to the hospital. So that's been our big move today.
Okay, and so one of the other things that Cayuga Health is now doing, especially out here in Ithaca, is that there is a drive-through testing center which has been pretty active this week. But one of the things that we really want to drive home and clarify is that you need to hit specific qualifications to actually go through this. Can you tell me what those qualifications are?
Exactly. So the process is that a patient, if they feel they have symptoms, would call their primary physician and they would screen them and determine if they're appropriate for testing here. If they do, they'll transmit an order to us, and then the patient would make an appointment here. They come to the testing site on Craft Road. It's a drive-up, and they stay in their car the whole time. They have a nasal swab performed by someone who's in full protective equipment, and they go on their way. The important thing for people to remember is that if they're tested, they'll be followed by the Tompkins County Health Department and will need to isolate at home until they get a negative result back.
And speaking on to those results, I know a big question is how long is this going to be taking? That way people know that are self-quarantine or in isolation, how long they might have to be waiting for these test results back.
We're seeing the range is about 2 to 4 days. Hopefully as the state brings on more testing capacity, that number will decrease.
Okay, and so another major concern, especially for those who are in healthcare working, is that how are you keeping your healthcare workers here safe along with the visitors who, even though you guys have had to limit visitation, how are you keeping everyone safe as they're coming into the building and working with these patients?
Well, we're screening people at the entrances, as I mentioned. That includes employees, making sure that if anyone's sick, they're not coming into the building. We're designing processes and changing the flow within the building to limit exposure, to do a little bit of social distancing even within the hospital, and have spent quite a lot of time making sure that there's hand hygiene solution available, that people are remembering to wash their hands, and to be extra cautious when we're seeing patients who may have any symptoms that are reminiscent of COVID-19. We're isolating them immediately, even before we have decided to do a test.
And then finally, you did mention to me earlier for patients that are in the Cayuga Health that, especially when it comes to maternity sections and whatnot, that there even is limitations with that because that's something that obviously can't stop every day. You can't stop a baby from being born.
Exactly. So we are, as the governor has requested, we're limiting visitors, but we are allowed to have one support person that's medically necessary with the patient who's giving birth, and so that's the exception that we've made.
Perfect. Well, thank you so much for your time, Dr. MacQueen. And thank you for everyone tuning in for hearing how Cayuga Health is working. And I'm going to toss it back to you in the studio, Renata.